My name is Janika Sherrod, and I am the Associate Vice President of VOA Health and VOA Justice. VOA Health is comprised of two programs, Outreach and Prevention and Determined Health. Our HIV team is focused on ending the HIV epidemic. The HOPPA program, which is Housing Opportunities for Persons with AIDS, is a program that provides short-term rental, mortgage, and utility assistance for those currently living with HIV or AIDS. This program is invaluable to our community because it helps ensure that those currently living with HIV or AIDS remain stably housed. We offer free confidential HIV testing and hepatitis C testing to our most underserved communities. We really focused on the populations that need to be tested the most. Unfortunately, there's still a stigma around HIV, and it's important that we are out there educating the community that HIV is no longer a death sentence. Our outreach and prevention specialists that work tirelessly in the community to identify those who are at a higher risk for HIV, they have been touched by this in some form or fashion, whether it's themselves or family members or friends.
6 years. I've been here 6 years. After they got moved from the location off Walgreens, I just kept coming back, and I heard of HIV before, but I really didn't think it was as big as what it is. And my involvement in VOA really opened my eyes to these things. And the more I got involved, the more I found out, my friends didn't come out and tell me they had it. I'm not saying I learned through here, it's just they came to these events. I'm like, oh yeah, I'm this. I'm like, oh, I didn't even know that. And we talked about it. And I guess that strengthened my friendships with my friends. Y'all really open about it, and y'all give a lot of information about it. And basically this place is a safe place. So when somebody do get positive about it and they feel like the whole weight of the world on their shoulders, they come here and y'all really relieve some of that. And y'all do all these outreach programs and y'all do all these events just to spread words. And I know most of my friends are HIV positive. They go to these events and they feel safe. They feel like this is home, you know?
I'm just making sure that you're up and ready for physical therapy.
And our Determined Health program is comprised of community health workers. Community health workers are frontline public health workers who are trusted members of the community, who have a unique lived experience aligned with the clients that they serve tirelessly every day. They're working in the community to be able to link people to care, to be able to navigate them to resources and really address their basic needs. Because we know that if individuals' basic needs are not met, then they're not going to prioritize their health. Our program is really focused around how do we advance health equity for our most marginalized and disenfranchised communities. The community health workers that are working in these communities are those who have been the clients themselves. They know what it is to really feel oppressed and to feel that they don't know how they're going to get out of the situation that they're in. And that if just someone just empowers them or just gives that extra lift, that they will be able to go to the next step. You know, one of the challenges of being a community health worker is that they have to do this unique dance between juggling the medical needs of their client or the behavioral health needs of their client and the social needs of their client. And yet, each day they find a balance in order to do both. The work that they do really is priceless.
My name is Charlotta Barnett, and I found VOA and Miss Michelle last August doing my breast cancer surgery. I had tried to get in touch with some organizations out there where I live at in the Newburgh area, and there really wasn't anything out there for us. What I was going through and having custody of an autistic grandchild and another little one, I really needed some help. And I found Miss Michelle through Humana and VOA. VOA and Miss Michelle was there the whole time, from the breast cancer thing to getting both hips done. And then, like I said, my mom died on me, and Miss Michelle was like, I got you. Here I go, I just bust out crying, and she bust out crying with me. She's like, but I got you. And I'm like, yes. yes, I got a friend, you know, a real one, you know, not only the programs, but I've got a new girlfriend, really I do. And I was like, oh, this is great. Because there's nothing in Newburgh, nothing. And my eyes are watering again because she just is the truth. She really helped me. She didn't just talk the talk, she walked it too. And she walked it right beside me. If you need something, call VOA and see what they can do for you and the programs that are available, because I had no clue. I had no clue.
You know, as a Black woman, I have seen throughout my life the challenges that people like me face, and how in our communities we have a lack of resources or a lack of investment in our communities. And it is what has pushed me and propelled me to do the work that I do for all underserved Black and brown poor communities. One of the things I love about VOA is that we really are committed to our mission. We really are striving every day to serve our clients and to serve the most vulnerable, and it's what I live for. It's what makes me get up every day to do my job.